So instead of doing your MDS, for instance, which might not be what you want to do, you do say MBBS after BDS. And in 9 years, you are a full doctor. You can treat teeth and you can treat the person.
Hello, everyone, and welcome back to What After Dentistry. There has been research that most BDS students opt for BDS because they could not crack an MBBS seat. But let me ask you, how many of you dare to do MBBS after BDS or even MDS? Hardly any, right? In today's video, we are going to look at the possible opportunities one can gain from completing a dual medicine and dental degree. And to discuss this, we have Dr. Dipesh Rao, a dually qualified pediatric maxillofacial and craniofacial surgeon at Bhagwan Mahavir Jain Hospital, Bangalore. He completed his MDS in oral and maxillofacial surgery from SDM Dharwad, following which he did a 1 year fellowship in craniofacial surgery at Bhagwan Mahavir Jain Hospital in the year 2010-11. Globally, only a few surgeons are trained in both pediatric maxillofacial and craniofacial surgery, and Dr. Dipesh is one of them. As a mandated requirement of having an MBBS degree to get trained from one of the world's best universities, he completed his MBBS from Raja Rajeshwari Medical College in the year 2016, following which he gained his pediatric maxillofacial fellowship at the Royal Children's Hospital, Australia, and craniofacial expertise from the University of Oxford, England, both of which are considered as few of the best universities globally. Dr. Dipesh's journey is a true depiction of courage and determination. If you have it in you, no one can stop you from achieving your heights. So if you are still unsure about dentistry today, then this video will surely get you motivated to carve your own path. Let's hear. Hi, Dr. Dipesh. It's a pleasure to have you on our channel, What After Dentistry, to talk about the pros and cons and the opportunities after pursuing MBBS, after BDS or MDS. So, welcome you once again.
Thank you so much.
So, we
Thanks a lot.
get into the formal discussion. Like, I want to understand what motivated you to pursue MBBS right after your MDS in OMFS.
Well, I think the most cliched answer would be the fact that I always wanted to do medicine. But having said that, when I joined maxillofacial surgery, I kind of had a preset goal in my mind that if I'm joining MaxFax, I would like to do birth defects and birth anomalies. So when I learned more about it, I realized that there is cleft and craniofacial anomalies, and the training that I would require to become a craniofacial surgeon would be done in places outside India. That was what I learned while I was planning to do MaxFax surgery. So when I got my admission into SDM, that's the place where I did my MDS in oral maxillofacial surgery in Dharwad. I had this kind of sketch in my mind that I will do cleft and craniofacial disorders for a living after maxillofacial surgery. And then if I have to do that, if I have to pursue that, I will have to do medicine, because the most of the training programs outside India are dual qualified programs, which means in the UK, in Australia, in some parts of the US, in most parts of Europe, you have to have dentistry and medicine to become a maxillofacial surgeon. So that's mandatory. And if that's the norm that they have set, I decided, okay, fine. And if I have to match their norms, I will have to do medicine. That's my blueprint.
That's great. This is a very good point to know. I mean, we were not aware about this. Yes, we knew that, craniofacial surgery is one aspect or one stream that MDS in, usually the oral and maxillofacial surgeons, they dwell into. But doing an MBBS is like a requirement for it. We were not very sure about it. So thank you so much for being an eye opener in this case. So, if an PDS or an MDS graduate has to apply for MBBS, what is the route? Is it like you still have to sit for a NEET examination, or we can directly apply
Yes.
medical college?
So it's funny that so earlier, I mean, before NEET became compulsory, it was a little wavered, as in there were some independent exams. There were just not so much discipline in the way things were happening. I think NEET itself revolutionized how admissions happen.
Yes.
I probably am fortunate. I just joined the year when NEET became was coming into fore, and then the next year, as when I was the first year medical student, NEET became compulsory. So in that case, I'm a little fortunate. Having said that, you can imagine yourself. You'll have to probably, yeah, you will have to sit the NEET exam, irrespective of whether you're doing after BDS or MDS. But it becomes, although it is slightly difficult, I think the demand of medicine or dentistry, for that matter, is not as high as it used to be 20 years ago when I sat for an entrance exam. Which there are so many more diverse options that children are nowadays taking, that medicine, engineering, the mainstream work is becoming that much less popular.
Correct.
So what is happening is, if you do well and if you just crack the exam, there's a good chance you will get medicine.
Okay.
And because you have your dental degree and or your MBS degree, what happens is you have a know-how of most of the basic subjects, and I think that will help you get going in medicine.
Okay.
Because the first year is the most toughest, right? Whether it is dentistry or medicine, everybody says the first year is the toughest. It's because from your 11th, 12th, or high school, or what you call a junior college, getting into a professional college is a difficult transition to make.
Correct.
That transition you don't have to make because you're already slightly more mature. So after getting in is easy. How to get in, I think NEET right now is the only real solution to joining medicine.
Okay, okay, that's fair enough. And the number of years, will that go down? Will there be a leeway in that, or still I have to pursue it for like 6 years?
Uh, so I don't think there are shortcuts.
Okay.
So although the bridge course and all of these have been popular, proposed, and everybody's waiting for that wonderful bridge course that will come into place. Uh, till such time, people waiting for bridge course have lost 5 6 years. You might as well had joined the medicine at that point and finished it. That's exactly what I did. I did not wait for a bridge course to come. I did the full 6 years. But those who were waiting for bridge course are still waiting. And the thing is, there is no leeway, and I don't see why there should be one, because medicine in its own right is demanding. So although you have some orientation, it's not like if it was shorter, it would have been any easier to do it. So yeah, it is the same.
Okay, okay.
Going back to school is going back to school. It's not going to be easy whether it's 4 years or 6 years
Correct,
or
correct.
3 years, whatever.
Yeah, right. So if I just assume like you did everything at a stretch, there was no gap in between, right?
Yeah, again, that is pure fortune. I found a mentor early in life who kind of gave me sound advice. So I work with him now, Dr. Krishnamurti Banda, and I think he let me understand that, okay, if I want it, just join, and don't worry about what's going to happen and what's not going to happen and all of that. If that's your perspective of getting where you want to be, get going. And that's how I did not take a break. So I finished my MDS, and I was a fellow. I was doing my fellowship. So fellowship is a year where you try to sharpen your skills and narrow down on what you're doing. So I did a fellowship year in cleft lip and palate. And just that year, I joined. After I finished fellowship, after 1 year of fellowship, I joined medicine.
Okay, so it's like almost 14, 15 years of, complete education. And really, like, you need a very strong motivation to, pursue such a long education pathway for yourself. And it's not just, I think, about you, your family and your friends, everyone has to be also supportive, because many times your near and dear ones will, they will let you down. Like, how long are you going to take time to study? So it's like hats off to you. And I think it's very, very inspiring. So for all the audience who's watching this, if you are really keen to understand the nitty-gritties of medicine and dentistry, it's highly recommended that you pursue MBBS right after your BDS or MDS, to become, or give a kickstart to your medical career in a great spike which is required in the industry. So hats off to you, Dr. Dipesh. Now, since you mentioned about the bridge course, that was one of my questions in the session today. We know that there are a lot of talks going on around this particular course. When is it expected to get approval and get going?
So the way bureaucracy in our country works is that there's going to be resistance for every change, isn't it? So the fact that somebody is going to offer an accelerated program, the medical council is definitely not going to be happy about it because they don't want more medical doctors because after medicine you can do any post graduation as well, right? So these are the bottlenecks or pressure points because of which is a very good move to have a bridge course is not getting its right approval. It's because of the fact that there are bodies which not probably fancy others getting a rapid course out of it. So I think there is no real clear timeline in which this will be approved. If it does get approved, that will be great because our country still needs a lot of doctors, dentists, postgraduates, irrespective of what it is. Most of the people they eventually settle in tier one cities and then regret that they've joined healthcare industry, whether it is medicine or dentistry. But there is still need for tier two cities, tier three cities, in smaller towns. There is need, and at the end of the day, you can have a good living irrespective of, and medicine itself gives you a larger perspective. It's not just practicing medicine, like you say. You can do so much more even if you don't practice medicine. There's so much more you can do and add value to the society. So there is good things to do if you just do a graduation in MBBS or BDS, whatever it is.
Correct, correct.
Yeah.
And while we are pursuing, or while any graduate pursues MBBS after their, dental education, what are the challenges that one can face?
Financial, of course. Your friends are all now working and you're not working, and it's going to be difficult because you assume that by so and so by 28 when I finished MDS, at 27 I should be earning some money and at least having some face to show that okay, I am getting some money that I can look after myself, at least my fuel expenses and all that. So you will have to then put in extra hours, which means after medical college you go back, and probably I was doing some oral surgery work in the evening, but actually ironically I also did some gynac work in the evening. So when my in-laws had a nursing home, so I was married that year when I joined medicine, and my in-laws had a nursing home, a maternity home. So they gave me the idea that I could assist C-sections in and around and get some funds out of it. So there are so many ways of getting money. I mean, you can just be an assistant surgeon to other surgeons and get some assistant fee. So that kind of helps you tide over that years when you think you're financially unstable or unstable. Sorry, and I don't know. I mean, that's the first difficulty. Second is, of course, your family needs to be on the same page. Like you said, that it's not just your individual effort. Your family has to be supportive of the whole idea of doing it. There'll be so many lows. Everybody will hit lows. We will all feel that this is not going the way we expected it to go. But then the family collectively helps you tide over all these issues. And yeah, it is not easy. It is definitely not easy. It's been my worst 5 years of my life. If I have to isolate my life into pockets of five, that's probably the worst 5.5 years of my life. But then it's okay because I wanted it. It was me who decided that I wanted to go in. And the other advantage is that I got some good friends in my medical college because I never went ahead and showcased that I'm your super senior or whatever. I just tried to blend with the crowd, and they were very supportive of me. They helped me too. So I had a very good bunch of batchmates who helped me feel that I'm included in everything. And yeah, it worked.
Absolutely. That's amazing. That's really amazing. So, did you also feel, like you said, you had to blend with some obviously young people, and then did you feel that kind of gap?
No, actually, I was so amazed at the fact that they were all 9 years younger than me, or some 10 maybe. But it just so happened that I could. In fact, I was playing the same video games that they were playing, so I just made sure that I blend in with them. If they're playing Clash of Clans, I was in their same clan playing the same video game whenever I had the time. So it was fun. It was fun going back winding up time a little, and then feeling that you're still welcome in the same group was good. And also the fact that in fact, I think even if I go back to medicine now, we will still be able to gel with them. It's because the kids have become so much more mature. They're not like us. If I was their age, I would not. I would have closed doors to anybody senior, 2 years senior to me. But they are not like that. They are much more street smart than I was when I was their age. I can definitely say that.
And I think they have jotted down their path also very well. Like
Yeah.
when I was also pursuing, I was not very clear, which route to go. Will I be working under someone first, or then I will be, setting up my clinic, or will I be changing my career path? I didn't had that clarity. But I think kids today, like the young generation today, they have that kind of clarity also with what they are doing with their life. Yeah, correct.
Correct. There's a lot of information available at hand for them, so they make the most out of it.
Correct. Absolutely. So, what do you suggest? What is a better route? Like pursuing BDS, then MBBS or MDS, or it's BDS, MDS, and then.
Again, this is not the first time I've been asked this question. Now, uh, in fact, a lot of maxillofacial surgeons who I meet, they want to know whether they should do medicine, and they would want to take it up as well, because this then allows them to feel that much more comfortable in their private practice. There are accomplished maxillofacial surgeons in the country who are singly qualified, who are just dentally and maxillofacial trained. But times are changing, so there are so many more maxillofacial surgeons in the space that to have this, break some barriers and all of that becomes slightly difficult for them to enter. So they ask whether doing medicine helps you. It does not give any. So degrees in India don't count. It does not matter what you have. You can have 10 degrees, but if you're not good enough in your work, you're not good enough. You can have just one degree, and if you're good in your work, you will have your patients come to you. It's basically that. You have to understand that all people enjoy writing more letters on their visiting cards or anything. I don't even write doctor in front of my name. I don't even kind of look at it like that, because at the end of the day, patients are going to validate whether you're a good surgeon or not a good surgeon. So whether you do it after BDS or after MDS, I think the time, if you think of it, if you're doing after BDS, then you're not going to do MDS. You might do something else.
Okay.
No, so if your interest is going to be something else but maxillofacial surgery, then you might as well do immediately after BDS. So you do an MBBS after BDS. You can use the fine motor skills that you've learned in your BDS, like holding the drill. You can use it in so many other fields. Like you can do, so for instance, you can apply it in ENT. You can be a fine ophthalmic surgeon. You can do plastic surgery. You can do maxillofacial surgery if you want. But there are so many domains and avenues that you can open up. All that you have learned in your 4 years of dentistry will not be wasted, because you will acquire some skill which will be utilized further down in your post graduation after medicine. If you do it after MDS, it is obviously most commonly after max fac surgery. The advantage is that you will still be a maxillofacial surgeon, so you'll still be attending conferences, doing your maxillofacial work, and doing medicine at the same time, like me. And in 6 years' time, when you come back to the scene of maxillofacial surgery, people will know you existed. So you'll be 6 years plus more. So you'll not lose time. And it's not just 15 years that I have been studying. I've studied for 20 years. 2001, I joined dentistry. 2021 is when I first got my consultant job. But I'm fortunate that I've joined my mentors back in their unit. And if I have to look around my contemporaries, I have not lost time. I am either at the same level as they are, or probably ahead of a lot of them. So it has not kind of derailed me at all. So the time that you take does not derail you at all.
I think it'll just give you like a spike in your career that I completely feel like when you put yourself too much into or completely into an educational platform, that obviously education never goes wasted. So that will definitely, add on to your career growth only. I completely agree to that. So now when you've already, answered some bits and parts of how does MBBS help in accelerating your career, or how does MBBS help you in establishing as a good dental surgeon? Can you elaborate? You have more pointers on, what kind of benefits or advantages one can gain?
So it depends on what you want to do as in next. Say, for instance, somebody decides to do BDS, MBBS, and stop. Okay, that means you can be a general practitioner, look after a lot of complex dental problems with in health condition issues. So, for instance, whatever the issue may be, because you're medically qualified, you have a know-how of all of it. So instead of doing your MDS, for instance, which might not be what you want to do, you do say MBBS after BDS, and in 9 years you are a full doctor. You can treat teeth and you can treat the person if you like to do. That's one of the ways of looking at it. So uh, the avenues are lots. I mean, I don't think that you can measure it and how to do it, and how it all depends on what the dentist wants to do. There are some dental students who, I would like to say, because this every month I get a call from either a dental student, an intern, or one of the most bizarre was an endodontist, in a final year endodontics. She wants to probably do medicine as well. So when they ask, I kind of try to find out why they want to do medicine. And most often it is that they feel that they are better suited to be doctors and not dentists. But if they are better suited to be doctors, then they can do it irrespective of what they are. Because at the end of the day, if your calling is being a doctor, doctor meaning medicine doctor, not dentists are also doctors, even if people argue that they aren't. I totally believe they are. So medicine doctors, and the work that they do, if it satisfies them, then that's it. So it is at the end of the day, whatever you do at whatever point you want to do it all depends on whether this will give. I love my job. Every day I operate, I look at my work, and I'm appreciative of the fact that these patients have chosen me as their surgeon. I'm happy because the other patients, I'm not a surgeon, right? The patients have to be there for you to be a surgeon, and a lot of patients. We do a lot of surgeries every year, and every year I grow as a surgeon. But I also feel fortunate that these many patients chose us or our team or me for their surgeries. And I love my job. I cannot imagine my life without this job that I do. That's why all of this, all the 20 years, is nothing, because I end up doing the work I like to do.
Correct. I think at the end of the day, it boils down to one point, whether you are satisfied with the kind of work that we have been.
Yes,
Yes.
absolutely.
Yeah. So now, last question in terms of the MBBS. Once a graduate, like when you completed your MBBS, was your registration transferred from DCI to MCI, or you need to do
I have both. We have both. So I have a KMC registration number, that is Karnataka Medical Council registration number, and I have a Maharashtra State Dental Council number because I did my BDS in Maharashtra. I did my MDS in Karnataka, but because the dentistry license remains from your BDS. So yes, so I have both the licenses, and it is the same in the UK. The GDC and the GMC, the General Dental Council, the General Medical Council numbers are available for all maxillofacial surgeons. So they have to have dental and medical registration number. It's similar in Australia, and I keep referring to UK and Australia is because I spent one year in each of these places for a fellowship after my medicine. So yes.
So when you apply for the fellowship in UK and Australia, since you have mentioned about this, is it like one has to appear for some kind of examination, or they can directly apply in
The fellowships are direct. So basically, of what on the background of what you have done, there is a shortlisting, and then there is an interview. And if they feel that you are kind of focused to the field that they are working in, they will select you. So it all depends on your field of interest. It has to be very narrow, because the fellowships are eventually narrowing your sphere of work. So if they start appreciating what you have done thus far, then they will select you as their fellow. And the fellowship is basically a work experience wherein you're working, you get paid for a fellowship. So you it's not like a course which people do and call it a fellowship. It's a fellowship where you get paid to work.
Okay.
So yeah.
And suppose if you had to work there itself, any, maybe UK, so you will have to sit for both the examinations, GDC also and GMC also.
So yes, so if you want to permanently settle, there are ways and methods of getting your registration sorted. Unfortunately, for GMC, PLAB is the only way out. For GDC, you can get some temporary registrations and then permanent registration, and you can just probably write the ORE. So it depends on what you're doing. And now, in most of these countries, there is the definite need for more healthcare professionals.
Yeah.
So things are fluid. Everybody gets in somehow or the other. You can, if you are working hard wherever you are, you will get what you want. It's not difficult. So rules keep changing. The rules that applied 5 years ago are not applicable today.
Correct. Yes, absolutely. So any last thoughts or advice to the audience?
Follow your dreams. They will always come true.
Oh, thank you so much for such an
Thank you so
interactive
much.
session, Dr. Dipesh. And it's been really an eye-opener. Many points
Thank
I
you.
was completely unaware of. So thank you so much for putting out that information for the audience.
Thank you. It was a pleasure for me as well. Thank you.
And for all the audience, I hope you got motivated. You got inspired from his journey. And if anyone wants to pursue MBBS after BDS or MDS, you can always reach out to Dr. Dipesh. I will link down his LinkedIn profile in the video description. So do check that out. And yeah, before signing off, please subscribe to our channel. It's absolutely free. Like and share this video because this might help out people who want to pursue MBBS after their dental graduation. So thank you so much for patiently listening to us today. I will see you in the next video. Until then, bye and good luck.